Good morning, good afternoon, good evening, wherever you may be. Welcome to OET Medical Online with me, your teacher, or one of your teachers, Trevor Gordon. In today's lesson, we're going to give you some help with the formation of certain structures in your letters you have to write in the exam. And just a point here before we move on, when you see the structures, there'll be examples of three or four different sentences, but they'll be structured in a different way, but the meaning will be the same. Okay, so in today's letter, we're looking at a patient who's going to be discharged. Now here, to be discharged is an adjective. Or the hospital want to discharge him or her, that's a verb. Or the hospital are discharging, that's a present continuous. So remember, in this letter, your grammar's very important to the outcome. The examiner will be checking and looking at your variety of grammar and correct use. So, we're going to take this information and show you how to create a variety of sentence types to help you with your variation when writing sentences. The first thing to note is that with a discharge letter, the medical history of the patient is the primary information, as the person or institute receiving them has to know what treatment they have in order to continue the care. That should say what treatment they have. Oh, they have received. No, I'm actually correct. Okay. So, for this essay, the logical order of paragraphs will be, the first thing to know is that with a discharge letter, the medical history of the patient is the primary information, as the person or institute receiving them has to know what treatment they've received in order to continue the care. So here we have a typical format of the letter. You'll have the introduction, the body paragraph will be medical history, because there's no treatment being given now because the patient is going to be discharged. What happened to the patient while they were in hospital, and the current status now, and the discharge status, and then finally the conclusion. So we'll cover the introduction of the letter with an inclusion of the word discharge, being discharged, or discharging. This tells the reader of the letter what kind of letter it is immediately, because when you're writing the letter, they don't want to look around and think, what kind of letter is this? They want to know immediately. So put the vocabulary that shows this at the beginning. So here are some example sentences. I'm writing to discharge a patient into your care for rehabilitation. Now we're using the verb discharge, or even the infinitive. To discharge is an infinitive, discharge is the verb. I'm writing this letter to request that a patient be discharged for pulmonary care. I always get that wrong. Pulmonary care. So be discharged can be an adjective, or it could be passive. The purpose of this letter is to request the discharge, noun, of a patient to you for pulmonary rehabilitation. So there's three different ways to write your introduction using the verb form in different ways. The reader can clearly see the use of the reference of the letter in one of its forms. The word discharge clearly tells them it's going to be a discharge, or it is a discharge letter. So practice writing these kind of sentences. Don't just write one sentence. Write several sentences so you feel comfortable. From my experience, people write a sentence once and think, oh, I know it, so I don't have to do it again. You have to write a sentence structure several times to make sure that it's understood, it's in your head. When you have to reproduce it, you don't have to think about it. That's the position you should be in before you go into the exam. So we then follow this with patient information. When we introduce the patient, we then introduce the patient by using a variety of sentence structures. Now here, what I've done is I've given you different types of sentence structure that you can use, because sentence structure and different types of grammar are the things, or some of the things, that will achieve you a higher score. So we have, Miss Davis is a 41-year-old married teacher who underwent treatment for suspected hospital-acquired pneumonia. Past simple tense, who underwent. Miss Davis, a 41-year-old female, has undergone treatment for suspected hospital-acquired pneumonia. Present perfect. The patient, Miss Davis, is a 41-year-old woman with recently diagnosed hospital-acquired pneumonia. Participle adjective. The name of the patient is Miss Davis, who is 41 years old and has suspected hospital-acquired pneumonia. So here I'm just connecting the two parts of the sentence with a connector and. The patient's name is Miss Davis, a 41-year-old female who we recently discovered has suspected hospital-acquired pneumonia. This is a relative clause, who we recently discovered. Again, practice writing variety. This will help with your grammar and vocabulary, as well as improve your knowledge of sentence structures for the letter. The last part of the introduction is slightly different from other letters, as you are discharging a patient. The patient may go either home, to a care facility, or to another facility. We need to explain why the patient was in the hospital. So this is the initial reason the patient was in the hospital. If you look at the notes, in fact, the notes will be underneath this video. There'll be a link to the notes, so have a look at the notes afterwards, and then you can compare the notes to what is on this video. She was admitted to hospital following a fall at home while on the stairs and is due for discharge today. Present participle, following. She was taken to hospital after a fall at home and is due to be discharged today. So we use a linker between after a fall at home, and then we're using the passive. She is due to be discharged. The patient arrived at the hospital after having fallen at home while ascending the stairs. She will be discharged today. So it's an ing phrase, after having fallen. She arrived at the hospital after an accident at home. She was going up the stairs when she fell, past continuous, and is going to be discharged today, present continuous. So you can see in these sentences I'm showing you different kinds of grammar. These previous examples provide indicators of different types of grammar structures which the examiner will be looking for. Practice 2 or 3 variations of the final part of this. So practice these sentences. Practice using the different types of grammar. So again, you'll be prepared when you do the exam. You'll be able to write in these styles and increase your grammar. Now, the first paragraph, we begin to include the patient's medical history mentioned in the notes. This should be the first part of the letter, unless there is some history or a factor which needs to precede this. There isn't usually for a discharge letter, but if there is, again, read the notes. If the notes tell you differently, then follow the instructions or follow the information on the notes, in the notes. The patient has had COPD since 2001, for which she takes Flovent and Pulmicort inhalers. Now you can see here again, the blue structures are the same, the red structures are the same. The patient has suffered with or suffered from, present perfect, suffered from, suffered with, present perfect, and uses Flovent in the form of inhalers. Miss Davis was first diagnosed with COPD in 2001 and has been suffering from it ever since. Present perfect continuous, has been suffering. She takes Flovent and Pulmicort in inhalers, present simple, in red. She first developed or contracted COPD in 2001 and has since used inhalers with Flovent and Pulmicort. So there's lots of variety there. Practice using these types of variety. We can also include the family history at this point, as it's directly relevant to her case. So she also has a family history which includes lung disease in both parents. You can say in both of her parents, or you can say in both parents. Grammatically, they're the same. In addition, there is a family history of lung issues from both parents. Also of note is the fact that both parents, or both, that should say both her parents, not her both parents. Both her parents, my mistake, suffered from lung issues. Now, we have to remember that if the family history is not relevant, we don't need to include it. Because what we've got to ask ourselves is, when the person receives this letter, will it help them to do their job more efficiently or more effectively? If the family history is not relevant, then don't include it. If it is relevant, then it should be included. Here, the history has a direct relevance to the patient and will give the receiver of the letter extra useful information. So next we'll move on to admittance and treatment. The information of many letters will come with multiple groups of information, many of which will overlap. Your job is to sort out both the relevant and irrelevant, and also which things can be grouped together to reduce the number of words to within the limit required, 220. 220 plus 10, we say. Here, we select the most relevant information. Always think to yourself, what information does the person I'm writing to need to do their job effectively? And also, what information do they not need? So this is your job. As the medical professional, you will be the ones required to know this. I'm not a medical professional, so I don't know. So you have to go through the information and decide what is needed and what isn't. So here is the information that we're going to use. A hairline fracture of the leg or femur, losing blood from her left arm, taking morphine, taking Panadyne, and a wound dressing. So these are the things that have been highlighted as things that should be included. So from this we can make a sentence. And as you can see, in each sentence, the red corresponds to the same information in each sentence, just like the blue, the light blue, the green, etc. So each sentence is just being reproduced with different grammar. During hospitalization, the patient first received a blood transfusion due to a loss of blood from a cut. was also given morphine and Panadyne for the pain, along with a wound dressing for her fractured femur. Now, you can say she was also given, but you don't need to, because what you're saying is the patient was also given. While in hospital, Miss Roberts underwent a blood transfusion due to a wound in her left arm which caused blood loss, along with morphine and Panadyne for her pain. And finally, she also had a dressing applied to her fractured femur. Miss Roberts had the following treatment while hospitalised: a blood transfusion due to blood loss from a cut on her left arm, medication in the form of Panadyne 40 and morphine for pain, that shouldn't be there, and also a dressing on her leg for the fractured femur. So, the past medical history is generally the same structure as it lists previous information. Now remember, this is what she came in the hospital for. The actual secondary thing happened while she was in hospital. So she came in because she had a cut and she had a fractured femur. So this was the initial treatment. So you're telling the person this is why she came into the hospital, but while she was there, something else happened. Now, we have to describe the pneumonia, which is what she got while she was there. During her stay on the date, the patient began to exhibit features which were synonymous with pneumonia. She began to cough, develop a fever, and pleuritic chest pains. So this is done in the past simple. While in hospital, she had started to display symptoms of a fever, a cough, and pleuritic chest pains, which subsequently developed into pneumonia. So we have past perfect, she had started, and then we have participle adjective, which subsequently. However, on the 16th of the 9th, 2020, Miss Roberts was developing signs and symptoms consistent with pneumonia, which manifested themselves as a cough, a fever, and pleuritic chest pains. Past continuous, was developing. So we have this information now about how the pneumonia started and some extra detail about its progression, how it developed, etc. Then we have the two final stages of treatment that are detailed in the following sentences. So you'll see this information in the notes. So remember, we're telling the person how we treated the patient and what we did for her, what we gave her, etc. So that needs to be, all that needs to be provided to the receiver of the letter. A subsequent examination revealed a temperature of 38.4 and a level of 94 for her oxygen saturation, which was treated by oxygen therapy, 2 litres. She underwent an examination which showed her temperature as being 38.4 and her oxygen saturation level at 94. Due to this, she was given 2 litres of oxygen as therapy. The patient was examined and it was discovered that her temperature was reading 38.4. Along with this, Miss Roberts had an oxygen saturation of 94 and was subsequently treated with 2 litres of oxygen therapy. So again, the same sentence, the same information, just written using different grammar structures. So again, look at them. Practice writing sentences similar to this. Make sure that you're using the correct grammar formulas. And the next set, intravenous linzoid therapy was performed due to an X-ray which had discovered a dense white shadow. She underwent intravenous linzoid therapy after an X-ray had revealed a white shadow of mass density. And now we've reversed this. Following the discovery of a dense white shadow from her X-ray results, she was given intravenous Linzoid therapy. So again, same thing, just adjusting the grammar. So now we can wrap up the information by outlining the condition of the patient pre-discharge and also the discharge plan. So the things we're covering: treatment effective, eating and drinking well, IV antibiotics, chest pain or coughing, ECG normal. The patient has progressed well in her recovery, and although she has chest pains while coughing, her ECG is normal. Eating and drinking well, it's not that important because it says the patient has progressed well in her recovery. That means she's getting better. So eating and drinking can be included but doesn't need to be. Although she still has chest pain when coughing, she has made a significant progression and has a normal ECG reading. Despite having chest pains, Miss Roberts has made a significant recovery and her ECG readings are regular. Again, underneath I've said you don't have to include every detail. For example, eating and drinking well is part of the patient recovery process. When they get their appetite back, then you know they're getting better, so it doesn't really need to be included. That tells you that the treatment is effective. Okay, moving on. Now, this talks about her discharge and a review. Again, all these things are in the notes. So the need to continue inhalers for COPD, the need for regular pulmonary rehab sessions, and the need for oral iron supplement. So, however, after her discharge, it is of major importance that she continue with her inhalers and oral iron supplements. To conclude, the patient must continue with her inhaler and oral iron supplements after her discharge. Following her discharge, she must maintain her inhaler use and oral iron supplements. So, two different sentences. Then we have the final review a week after her release. So the GP will see her in 1 week for an assessment. It needs to be noted that the patient needs to visit her GP in order to review her physical condition and undergo blood tests in 7 days' time. Please be aware that she needs to have a review of her condition and also blood tests with her GP in a week's time. It should be noted that Miss Roberts needs a review of her health by her GP as well as blood samples taken for review next week. So again, all these sentences are saying the same thing. This is just giving you the opportunity to see how the grammar can be written in different ways. Come on. Now we conclude the letter by making sure that we have what we want, and the receiver of the letter has what they want, and the letter is very clear. It's telling them very clearly what you want them to do. That is important. So you're requesting, please undertake pulmonary rehabilitation sessions of the patients, which would be appreciated. The patient's pulmonary sessions for rehabilitation need to be undertaken. Thank you. Your continuation of the patient's pulmonary sessions for rehabilitation would be greatly appreciated. And then underneath we have a salutation. Salutation is a sign-off. Should you have any more queries, please do not hesitate to contact me. If you would like further information, please do not hesitate to contact me. For any further information you may require, please feel free to get in touch with me. So again, 3 different ways that you can sign off. Okay. Now, what this page is showing you is that you can take different colours from different sentences, and in effect you can join them together to practice writing your sentences using different grammar. Now, the sentence I've got here was taken from 3 separate sentences. So during hospitalisation was taken from 1 sentence. Miss Roberts underwent a blood transfusion due to blood loss from a cut on her left arm. She was also given morphine and Panadine for the pain, and finally she also had a dressing applied to her fractured femur. When you take portions from different sentences in previous exercises, you may have to adjust the grammar a little bit, but these are the things that you can practice. It says change the grammar parts where necessary. So this will give you more skills at piecing information together, so you know how to write a variety of grammar forms. Again, I know I've said this before, but this is one of the things the examiner is looking for. This will do 2 things: increase your grammar variety and show the examiner that you know how to integrate grammar types and still be accurate. Okay, so now what I've done is I've taken different sentences from all the previous things. I'm not going to go through this now. You can read this because this video is getting quite long. I don't want it to be too long. So read through this. And this is an example of the finished letter. And the second page. Okay, here we've got a longer word limit of 297. Now, the reason it's 297 is because I wanted to put as much in there to show you how I've taken sentences or sections in different colours from different sentences and how you can join them together. So this will really help you with your grammar. You take one part of one sentence and connect it to another part in a different sentence, but the sentences will all have the same meaning. So you could, for example, take part of section of sentence 1, part of sentence 2, part of sentence 3, and join them together. You should be able to do that with some slight alterations. Again, so we've done 297 words. I didn't feel the need to go through it again and reduce it because you know how many words you should do, but this will give you good practice. So finally, when writing your essay, ensure that you use sentences appropriately and learn how to paraphrase effectively. If you need to repeat a structure but with different information, then practice linking and mixing different types of sentences. These sentences will cover many of the grammatical requirements of the letter: tenses, linking, introductions, etc. And the tenses we talked about: present perfect, past perfect, present continuous, past simple, etc. Finally, do not just practice writing letters. Practice writing sections of the letter and putting them together in order to practice the cohesion and the paraphrasing. This will enable you to write much better and detailed letters and use a variety of grammar structures. Okay, this is the end of this writing review. Please visit our website, https://oetmedical.co.uk, and if you would like to book classes with us, go on our website. You will see our rates and prices for different classes, and if you decide you want to book a class, you can go to booking.oetmedical.co.uk and you can sign up and book your classes. So there are more videos in this series for writing coming up, so please hit the notification button, so when the next video is available and is put online, you'll be notified. So thank you for your time. Please subscribe to our main channel. We have two channels, one channel for people who take classes with us, so customers channel, and then we also have a general channel. So look at the general channel. If you decide to take classes with us, then we will subscribe you to the other channel where you'll get different videos but more detailed. Okay, thank you for your time and see you in the next video.